The ripples of health, knowledge, and exploration that flow from the Harvard School of Dental Medicine begin with you. These ripples spread outward toward the neighborhoods, toward the nation, toward the world, and you are the beginning.
At HSDM, my tuition, fees, food, and other living expenses approach $100,000 a year. Yet because of limited resources, the school is only able to grant me less than $20,000 a year in scholarship funding. All the rest of my money comes from loans. I took on this debt because of the opportunities HSDM offers: small class sizes, research, and education at the medical school. But I constantly feel the weight of the debt I will have to face after I graduate. When I finish orthodontics residency, I plan on practicing to pay off my loans. I love teaching and plan to teach in the future as one way to give back. Someday, when I'm able, I intend to give back financially as well, in the hopes of encouraging talented students to attend HSDM and ease their financial burden.
Colleen Green received the Nathan and Phyllis Goodman Endowed Scholarship at HSDM. These funds allowed her to pursue her passion of service to the profession through the American Dental Association while still a student, and to provide care for low-income children. The average debt of a DMD student graduating in 2013 was $162,000. Rita Hahn is among the few dentists who hold specialty certificates in both prosthodontics and periodontology. She was able to complete this work through a fellowship from MIS Implants Technologies and is now a rising star in bridging the gaps between these two fields. The average debt for a specialty DMSC or MMSC graduate leaving HSDM in 2013 was $243,000. A Dean Scholarship at HSDM was the key to unlocking Giuseppe Intini's future as a stem cell researcher. The scholarship brought him to an HSDM laboratory where he soon earned a prestigious award from the National Institute of Dental and Craniofacial Research. HSDM inspires students to dream, to develop a passion for learning, and to pursue personal and professional growth.
Our graduates become part of their communities wherever they may land, thus widening the ripples of good spreading outward from the school. These ripples are indeed powerful, with the capacity to change the world.
HSDM ripples span the globe. Jason Outlaw's experience with the Pan American Health Organization fundamentally changed his life and his perspective on dental public health. In Ecuador, he saw that the integration of oral health into the primary care system created accessible, patient-centered oral health care. He is now more determined than ever to improve access to dental care in the United States, especially for vulnerable populations. With a full load of debt from her pre-doctoral studies, Samantha Jordan had reached the limit on her student loans. Without the funds from the Delta Dental Dean Scholarship, she would not have been able to afford her dental public health education at HSDM. Alumni expand the ripples.
I really saw no boundaries, and that to me is really the quintessential part of what an education should be about. There's no question in my mind that the Harvard School of Dental Medicine opened up opportunities in my life that I believe would not have come along. It's really been a privilege for me to be able to participate in this.
I've been contributing to HSDM since I was a resident in endodontics. Now that I have my own practice, I'm able to give even more to the school. I feel that it's my responsibility to give to HSDM because my experience there fostered my passion for endodontics and launched my career. I hope other HSDM alumni and friends will join me in contributing to the campaign.
Start a ripple. It begins with you.